Hey guys, my name is Dr. Martha Gore, the physician behind the Traveling OBGYN podcast, where we talk about women's health topics and issues, but in a relatable way. In this episode, we're going to talk about sex, but specifically focusing on three things. First, we'll talk about the normal female body response to sexual stimulation. We'll then talk about the clitoral anatomy, and then also a little bit about the female orgasm. So this is something that interests you. Stay tuned. Hey guys, welcome to the Traveling OBGYN podcast. I am your host, Dr. Martha Gore, board eligible OBGYN. In today's episode, we are going to talk about sex. And no, I am not going to talk to you about the birds and the bees. What I actually plan on doing is talking more about how babies come from sexual intercourse in my next video when I talk about birth control. Literally one of my most favorite things to talk about. In this episode, my goal is to talk about the normal female sexual response. So from a physiological standpoint, how does the female body respond to sexual stimulation? Whenever we're talking about sex from a female standpoint, we have to talk about the female orgasm, or at least a little bit about it. And we'll also talk about the structure that makes the orgasm happen, the clitoris. We're going to talk about the clitoral anatomy. Now, before we get started, let's talk about some kind of housekeeping sort of things, all right? So, as you always know, in every episode, this content is inclusive of all people. If you identify as male, female, cis, trans, non-binary, this content is for you, as long as you want to hear about women's health topics and women's health issues. Secondly, my references, my sources will all be included in the description box always, but just want to remind you of that. And then lastly, this is kind of new. We're talking about sex today. Whenever there's a healthcare professional, an OBGYN especially, that is talking to you about sex, we are talking about all sexual acts. So that is penetrative vaginal intercourse, that is anal sex, that's oral sex, that's outer sex where you're rubbing genitals together, that is using your fingers to penetrate. All types of sexual acts. That's what we're talking about. Before we get started, be sure to like, share, and subscribe so you can find out when our next videos and episodes are available. All right, let's get to it. Now, as I stated before, the normal sexual response relates to the changes that the body makes in response to sexual stimulation between consenting adults. In the medical field, whenever we talk about this response, we highlight four specific stages. Those stages are very similar between men and women and include the following. We have desire, arousal, orgasm, and resolution. Now, there is kind of like a traditional, very like linear sort of way of looking at these stages where each stage occurs before the other. So you have to have desire to have arousal, you have to have arousal to have orgasm, etc. However, the American College of Obstetricians and Gynecology has accepted a more contemporary way to look at this model, where number one, these stages occur in a variety of different sequences depending on the person, which is more comparable to probably everyone's experience. And then number two, there are external factors that allow for each stage to even occur. So there has to be like a willingness to have sex, the context of sex, the motivation behind it, and even the perception of some kind of emotional or physical reward. Now, with that in mind, let's go ahead and talk about the different things that happen in each stage. Now, this is a women's health channel, and so I'm actually going to be discussing the normal sexual response from a female's perspective. In the desire stage, there's a lot of things that increase. Your heart rate increases, your breathing rate increases. There's an increase in blood flow that goes to specific areas such as the breast to cause fullness and hardening of the nipples. And then also blood flow is shunted to, or an increase in blood flow is shunted to the vulva and the vagina to cause swelling in that area. In the arousal phase, it's kind of an intensifying of the desire phase, where there's more blood flow that's shunted to the vulva and the vagina to increase that swelling. And you also have blood flow that's going to the clitoris to increase kind of the sensitivity of the clitoris, sometimes making it painful to the touch. Again, general muscle tension continues to intensify. Now, the orgasm stage is basically a stage where your heart rate and your respiratory rate reach their highest. It is marked by, or noted to have, a widespread kind of like involuntary contraction of your muscles. You can even have your uterus and your vagina contract during that time period too. There's a sudden release, forceful release of sexual tension during that time period as well. And then you have the resolution phase, where everything that increased, so your heart rate, your breathing rate, the blood flow to your breasts, and also the vulva and the vagina, it starts to come back to its normal stage. This stage is also marked by kind of like this general feeling of well-being and often fatigue. So those are all the bodily changes that occurs in each stage that makes up the normal sexual response. Now that I've talked about what's normal, I really want to talk about what's abnormal, also called sex disorders. And the reason why I want to bring that up is because in our mainstream kind of world, there really isn't a lot of emphasis on talking about sex disorders, especially from a female's perspective. In fact, I'll take it a step further and just say that there isn't really a lot of emphasis on talking about the complexity of sex disorders for both men and women. For example, for men, we kind of oversimplify the number of sex disorders that plague them by just focusing on erectile dysfunction, when there's actually a lot of other conditions that can cause for a male to not enjoy sex. Now, if we were to even look at a female standpoint, we don't even talk about it. And it's harmful because for both groups, I think it kind of puts this kind of like hesitancy kind of picture up where they don't really want to speak about it. From a woman's standpoint or a women's health standpoint as an OBGYN, I've definitely had a lot of patients that have come to me that have been very hesitant to let me know that, hey, sex is very painful in a way that I do not like it. I do not like, or I'm not able to achieve an orgasm. Whereas I was able to achieve one at some point. At a prior point, or they no longer have desire or interest. And not because of anything their partner had done, but that they just no longer have that. So we got to talk about that. The American Psychiatric Association has identified 5 sexual disorders that are associated with women. And the majority of them actually are in conjunction or associated with the 4 stages of the normal sexual response that we had talked about. Desire, arousal, orgasm, resolution. It's important to look at those things when you're then looking at the disorders. Okay, let's talk about it. The first disorder that we're going to talk about is kind of a twofer. It encompasses desire and arousal, and it's called hypoactive sexual desire disorder or female sexual arousal disorder. Something sounds familiar, right? Now those are big wordfuls, like mouthfuls. But for patients that present kind of like meet the criteria for those disorders, they complain of several things. They do not have any desire to have sex. They are unable to initiate or respond to their partners when it comes to sexual intercourse. They're unable to have sexual fantasies or thoughts. They're also unable to have genital or non-genital sensations during sex, and they're unable to experience excitement or pleasure during sexual intercourse. The next disorder that we'll talk about is a female orgasmic disorder. In this condition, this is where patients complain of a marked decrease in the frequency, a marked delay in their orgasms, a complete absence in orgasms, or a decrease in the intensity of orgasms. Now, it's important for us as physicians to make sure that these patients were able to experience orgasms previously to this. And then also whenever they're having these complaints, whether they're still having these complaints despite using stimulation or a vibrator in order to elicit an orgasm. The next condition that we will talk about is called genital pelvic pain and penetration disorder. Some of you might be familiar with the conditions called vaginismus or dyspareunia, and both those conditions are now under the umbrella of genital pelvic pain and penetration disorder. For these patients, they typically complain of significant difficulty with having intercourse, have substantial pain in the vulva and the vagina, and sometimes pelvic pain with intercourse. They also complain of significant fear and anxiety and anticipation with having intercourse. And then these patients will also have significant tightening of the muscles in the pelvic floor whenever they try to initiate sexual intercourse. And this is all relates to kind of like vaginal penetrative intercourse. The second to last condition that we will talk about is substance or medication induced sexual dysfunction. They typically experience sexual dysfunction by starting a new medication, increasing the dose of a medication, or discontinuing a medication. The group of medications that I think of that causes this kind of condition for most patients would be antidepressants. They just have a long history of causing sexual dysfunction in patients. So if you also struggle with alcohol abuse, that can also cause sexual dysfunction for some of my patients. The final condition that we will highlight today is a non-specific kind of cause for sexual dysfunction. For some reason, your complaints do not fit in with the definitions for the other disorders, then you just kind of go in non-specified. So that basically concludes our conversation or discussion specifically as it relates to sexual dysfunction and disorders. Also wanted to use this kind of plug to encourage you as women or those who are support of women to talk to your OBGYNs about your sexual health during your annual visit. We want to know and we want to be able to help steer you to the right direction, whether it's medications that we can help, getting you off certain medications, or getting you to the appropriate sex therapist or specialist. All right, so next we're going to talk about the clitoral anatomy, and then we'll also talk about female orgasm. So this diagram is actually from the website, theanatomyofpleasure.org. It's a really great website if you're interested in learning more about female anatomy from a male and female standpoint, especially when it comes to pleasure. I am not sponsored by them, by the way. I just thought it was a really great website to encourage other people to go and check out. Now, in this diagram, it's basically demonstrating the clitoris underneath the vulva, right behind the vagina, everything. So if you had watched my video where we talked about the female external and internal genital anatomy, you can kind of use that as a reference to kind of see what's going on. We talked about where exactly the external aspect of the clitoris is, but this one also shows, or this diagram also shows where it is from the inside as well. So here we have the entire clitoris, okay? It is about 9 to 11 centimeters long, which is substantial and which is pretty cool. So here we have the head or the glands of the clitoris. This is where you have all of your nerve endings and nerve fibers are densely packed. We then have the body of the clitoris, the legs, and the bulbs, all of which are composed of erectile tissue. So you can kind of think of like erection. So erectile tissue that tends to swell in the desire and arousal phases of the normal female sexual response. See, everything is coming together. It's awesome. And so in response to sexual stimulation, these structures, so the bulbs, the legs, and the body, typically will start to swell and kind of send feedback to the head of the clitoris, which will then create the bodily responses that you would see during an orgasm. So that's basically the structure and the anatomy of the clitoris. Now I'm going to just talk a little bit about the female orgasm in relationship to the picture that we have just seen. And I think it's more about just encouraging women to understand that vaginal penetration alone may not be enough in order to create an orgasm for a female. And that's actually shown within this diagram. Here we see that there are the bulbs of the clitoris, which are alongside the vaginal, that are alongside where the vagina is. And that's great. So with vaginal intercourse, we can see some rubbing and some stimulation of kind of the bulbs of the clitoris, which can then kind of create a signal up to the head. But it may not be enough. I just want to really encourage that clitoral stimulation is key for an orgasm. You can absolutely, I mean, everyone's different. Some women can actually just have an orgasm through rubbing and like other parts of their bodies, and that's enough to kind of stimulate and create for them to be in that sort of phase of the sexual response. But if you're not getting an orgasm through vaginal penetration, please understand there's nothing wrong with you. Try other things. I also want to encourage women to understand, don't just wait for your partner to be the one that creates an orgasm for you. Self-stimulation provides you with some type of education to know what works for you and guide their partner on what feels good for them. All right, and that concludes the second episode of the Traveling OBGYN podcast. Whew, guys, there was a lot of information in this episode, and I know that I didn't even scratch the surface in what there is to talk about when it comes to sex. What I hope to do is to get some of your feedback. Let me know if there are any questions in particular or any topics as it relates to sex that you want for me to cover in the future, and I can absolutely do that. As for now, I really want to make sure that everybody is aware. Please, if you heard nothing during this episode, please talk to your OBGYNs about the sexual issues that you might be having, the sexual concerns that you might be having within your relationships. Because we as OBGYNs, we want to be advocates for so many different things within the realm of women's health, but especially when it comes to sexual health as well. Okay? All right, guys, please like, share, and subscribe so you can know when my next episodes are going to be made available. And until next time, see you then.